Thank you all for coming. Today we're going to talk about hypothyroidism, which is low thyroid. It's often misunderstood, misdiagnosed, and frankly just missed. So an overview, we're going to talk about what is thyroid hormone, how is it regulated, some of the causes and the signs and symptoms you'll see with low thyroid, how to diagnose it and treatment, and some controversies. And then a few miscellaneous comments. What is thyroid hormone? Hormones in general are chemicals. Your thyroid gland is a little butterfly-shaped gland that sits about right here in your neck. And normally your thyroid gland makes mostly T4, which is not really the most active thyroid hormone. It has to go out into the periphery, out into your tissue, mostly muscle, liver, brain, where it's converted to T3. And this is the hypothalamus is a lower center of your brain that's like a switchboard, if you will. It receives a lot of information and interprets it and then gives commands on down the line. It releases a hormone called thyroid releasing hormone that goes right below the hypothalamus to another organ called the pituitary gland. And the pituitary releases a thyroid stimulating hormone in response to that. Well, the thyroid stimulating hormone then goes on to stimulate the thyroid gland. And the thyroid gland then will make T4, T3, and these other factors, T2 and T1 thyroid. Thyroid ablation, this is another common area that we end up treating a lot of patients for. They started out initially with either thyroid cancer or some other disease and had to have their thyroid removed. Graves' disease is high thyroid. And hair is a big one. Seems like particularly in women, dry, coarse, brittle hair. If women are noticing hair coming out in the shower, coming out in their brush, that's quite often associated with low thyroid. Fingernail changes where you get ridges that run longitudinally. And again, for the most part, it does fairly accurately reflect thyroid function. But again, back to the thermostat analogy, it's a little bit like trying to determine the temperature in this room by turning around and looking at the thermostat on the wall. It's going to be close most of the time, but it may be disconnected completely, and I'll show you a lot of examples of this. So I like to check the T4. The TSH goes up if you're low on thyroid to tell it to make more. The TSH goes down if you're high on thyroid, as though you're getting too much. And so we use this inverse test to guide our therapy. So why can't we rely on the TSH? Well, it's affected by both the T4 and the T3 levels. Remember when I drew the little diagram, I pointed out that T4 and T3 feed back and tell the hypothalamus and the pituitary, hey, quit making so much thyroid, we're good, we got plenty. Well, you can appreciate if T4 is normal or high, it'll feed back and play. So my best advice on diagnosing hypothyroidism is to know the symptoms of low thyroid. Now there are a lot of things that can cause fatigue, so we must be respectful. I'm very aggressive about treating. There's a question about to take thyroid with food or not. With Synthroid and some of the T4 preparations, it's advised to not take it with food so that you get all of it, so you absorb it completely. With Armour Thyroid, it's arguably better to take it with food. You still get it all. And so here's some real patient examples. T4, that's the upper limit right there, 1.8. T3's below. So here's that classic case where the T4's high, even above the reference range, and the T3's below, because she's just not converting. She's not converting T4 to T3 at all. Low on